a little wheel goes around, and then all of a sudden it says servers not available.
When Alberta's vaccine bookings opened at 8 a.m. for seniors 75 and older, Gary Mason was ready. The system wasn't.
I had two phones going too. I also phoned the 811 number on my landline and my cell phone, and they just kept ringing busy.
We expect there will be enormous demand for immunization. We have increased staffing for HealthLink to make sure that any senior who wants an appointment can get an appointment as quickly as possible, but we know this will take weeks to achieve.
They put up their website and bang, it's crashed. We want to make sure we nail this. We have it down pat.
Ontario plays defense over criticism its booking website won't be live until March 15th. Certain eligible, vulnerable people can make appointments this week, not just in Alberta, but Quebec and Manitoba too.
First Nations people in Manitoba older than age 75 can now make appointments.
Wednesday, Ontario announced a few new details. Those 80 and older can book the third week of March. 75 and up can book April 15th, 70 and older May 1st, and so on.
We will be able to start with essential workers the first week in May.
But exactly who qualifies hasn't been decided. And since the 34 public health units are tasked with coming up with local plans, the details become more confusing. Ottawa, for example, is launching its own booking portal first and starting vaccination for those 80 and older in the hardest hit neighborhoods March 5th, 10 days earlier than the province-wide plan.
We are once again leading the province in providing the vaccine to our residents.
British Columbia is also facing criticism for being slow. It's promising more details on Monday, especially for those 80 and older. The top doctor says BC has more seniors than Alberta. Ontario's premier used a similar line, saying Ontario in general has a much larger population than Alberta, but vaccines coming from Ottawa are generally allocated on a per capita basis. Abigail Beeman, Global News, Ottawa.